Hi everyone, if you see me for the first time, my name is John J. I want to welcome you all to this beautiful day. If you are alive and you are hearing me, the sound of my voice, that means you are blessed because we have life. So we are grateful to the Almighty God to be alive and breathing. We can see each other, we can hear each other. Again, my name is John J. I want to welcome you all. So I was thinking the other day because I was having a conversation with someone and they were sharing with me that they were having stomach pain. And not even just that person, I also noticed among my children, two of my girls constantly complain of stomach pain. So I was thinking, I'm like, man, what can be the cause of stomach pain? And I did a video before when I discussed some of the common conditions or symptoms that people have, and stomach pain. The other name is abdominal pain, happen to be one of those most common complaints that people have when they go to the doctors. So I did a little bit of research and I'm gonna be discussing to you one of the reasons why people have stomach pain, and stomach pain can be caused by so many different reasons, so many things. Like I said, gas can trigger stomach pain. For women, if they're on their menstrual cycle, it can trigger stomach pain. If you have ulcers in your stomach, it can cause stomach pain. If you have stomach cancer, it can cause stomach pain. If you have the stomach bug, nausea, vomiting, diarrhea, those can cause stomach pain. So many things can cause stomach pain. So today I'm going to be sharing with you one of those not so easily identified reasons why people have stomach pain, and this is one that primarily affects a lot of us from underdeveloped countries like Africa. So what I'm going to be sharing with you today is an infection that's called H. pylori infection. So the H stands for Helicobacter pylori. So Helicobacter pylori infection. So this H. pylori is a bacteria that can infect your stomach. So when that bacteria infects your stomach, it damages the tissue in your stomach and the first part of your small intestine, which is also called your duodenum. And when that happens, it causes redness and soreness in your stomach. And this redness and soreness is inflammation. And anytime you have inflammation, when something becomes inflamed, that can trigger pain. So, and this bacteria causes painful sores. This can lead to painful sores inside your stomach lining, which is called peptic ulcer. So, and these sores can affect the upper part of your digestive tract. So this bacteria apparently is very common. It's very common and it's the main cause of stomach ulcers. But many people will have this bacteria and may not even show any symptoms, or they may get ulcers. Some people may have it and get ulcers from it. And the reason why it is often overlooked and not easily diagnosed because it comes sometimes and goes. Like for instance, if you're having stomach pain, maybe if you didn't eat all day, you may say, oh, I have gas pain, take gas medication and it goes away. Or you take Pepsi or any of those over-the-counter gas medication and go away. Or you may attribute it to like the stomach bug or some other reason. So it gets overlooked. It is not one of those that is commonly diagnosed because oftentimes people really don't get tested for it because when your stomach pain comes, it goes away. So when this bacteria enter your stomach lining, it attacks the lining that protects inside your stomach. And then it can also stick to the stomach cells. And that's how it starts causing all this pain and it decreases the acid level in your stomach. So what causes this bacteria? So apparently the cause is not fully known. Nobody knows exactly what caused it, but it is believed to be spread from person to person. Guess how? It's spread from person to person by the mouth, through kissing, or if you come in direct contact with somebody who has it, their stool or their vomit. So let's say if you have a child that may have this H. pylori bacteria and have become infected by it, if your child is having runny stomach or if they're having diarrhea or if they're vomiting and you clean them up, or and and let's say you wash your hands, or you didn't wash your hand properly, or you forgot to wash your hand, you can get this viral. Or from kissing somebody that has it and did not know that they have it, you can get this viral. All right, and this can happen also. You can get this viral if you eat food that was not clean or cooked in a safe way. If you eat food that was not clean or cooked in a safe way. I don't know how many you can remember, but I know growing up in Africa, we really didn't care if your food drop on the floor. We have that 5 minute rule. You will get it and blow all the sand off of it food and put it right back in your mouth to eat it. And then also, if you drink water that is infected with this bacteria. Now, we all know the water issue growing up back home. A lot of water come from wells or come from rivers and things like that. And some of those waters are not properly treated, and they have this bacteria in them. And we drink this water, especially back home in Africa. Abroad, most time we are already infected with this bacteria from back home and not even know that we have it. Or if you come home, you pass it on maybe to your kids or your spouses through kissing or through helping to care for them, if they are sick. Like I said, you can get it by coming in direct contact with their vomit or the stool, which is the poop, or through kissing, excuse me. Right? So then if you're wondering who is at risk for this bacteria infection. So study shows that people that are over 50 years old seem to be at higher risk for it. If you are African or African Americans. So it says almost 50% of all African Americans have this H. pylori bacteria lingering around in the stomach and don't even know it. Can you imagine that? And then also, if you have come from an underdeveloped country, so Africa happen to be an undeveloped country, so that puts all of us at high risk of possibly being contaminated with this virus. And most people first get this virus when they are a child. So then what are the symptoms of the virus? You ask John J, how will I know if I have this virus? So sometimes you may have this virus for years and not even know that you have it. It can cause redness and swelling in your stomach lining, and which is inflammation. You can have sores, which is also called peptic ulcer in the stomach. And then if you do develop this ulcer, the ulcer cause stomach pain, and the stomach pain can be dull. It can be a dull pain that doesn't go away, or it can happen 2 to 3 hours after you eat, or it can come and go. That's why most people don't even think that they have it. It can come and go for several days or weeks, or it can happen in the middle of the night when you are sleeping and your stomach is empty. Okay. Sometimes the pain will go away when you eat or when you take medication that will help reduce the stomach acid. All right. Other symptoms of this infection is weight loss, not feeling hungry, if you feel bloated, like if you feel like you have a lot of gas, burping a lot, and nausea and vomiting. So usually in order to diagnose that you have this virus, is the main thing they do is they can do a blood test, or they can do your stool. They will check your poop. So usually the doctor will give you a specimen cup, a little cup, to give it to you to bring at home. And if you poop, you take a sample of your poop and put it in there, and they send it for culture to see if you have this bacteria. So blood test, stool culture, they do a breath test on you. And then another way they can tell, especially to see if you have developed also already from this bacteria, is by doing a procedure called upper endoscopy, or EGD. They pass a small microscope through your mouth, and it goes down and it check inside your stomach and your intestine lining to see if you have this bacteria. If you do have this bacteria, the way they treat it is by giving you antibiotics. Okay, so they'll give you antibiotics, and hopefully it clears the bacteria, and that's it. You don't have to worry about it. So antibiotic that will kill them. But the most important thing is, if this bacteria, if you have this infection carrying around and you don't know that you have it, it can lead to stomach cancer. Okay, so if you are out there and you constantly have stomach pain that come and go, when you go to the doctor, if you are Liberian, Nigerian, Ghanaian, from any African descent, any underdeveloped country, or if you're African American watching my video and you are constantly having stomach pain that comes and goes, and you don't know why you keep having this recurrent stomach pain, next time you go to your doctor, ask the doctor, Ask your doctor, can you please test me for H. pylori bacteria? H. pylori bacteria, because I seem to be having recurrent stomach pain that's not going away. All right. So before I leave, just to summarize this, I'm going to give you 7 key points about what we just discussed. So the H. pylori virus is a type of bacteria that infects your stomach. It attacks the stomach in the first part of your small intestine, and this can cause redness and swelling in your stomach. Many people have this bacteria and don't even know it. It can cause sores to develop inside your stomach and your digestive tract. That's called peptic ulcer. If it's not treated, it can cause cancer. So again, if you are out there and having recurrent stomach pain, ask your doctor. You know, most we have to be our own advocate, and this is the whole purpose of my YouTube video. It's just to make us educated, keep us informed of those common things that we need to know and be proactive for, because the doctors are human beings just like ourselves. They won't remember everything, and who knows your body better than yourself? So you know that you've been having recurrent stomach pain, or your children. As a matter of fact, when I did this video, I was thinking, because I got 2 of my daughters that constantly complain of stomach pain, and it didn't cross my mind to ask the doctor to check them. But the next time I go to their doctor's appointment, guess what I'm going to be asking her for? Can you check them to see if they possibly have that H. pylori virus? I don't even know if I have it, because I came from Africa. We all, we used to play in the dirt, play in the dirt. We'll eat any type of food. We do our little children playing cup, for all the leftovers, things that our parents will cook. We put it the tinapa cup and the old tomato cans, and we try cooking. And sometimes we used to actually eat those things, and that's how we get these bacteria. So I may even have it and don't even know I have it. But guess what? At my next doctor appointment, I am going to be asking my doctor to check me for the H. pylori bacteria as well as my kids. So I hope this video was helpful. Sorry I didn't intend for it to be this long. I try to keep them really short, but I hope this information was helpful. Sometimes it's hard to cut it short because I want you to get as much information as you can get, that you can take that proactive step and be healthy. So remember, take care of your body. It is the temple of God given to you. You are stewards of your body, and you are held responsible, and you are held accountable for your health. Be proactive, be blessed. Until we meet again, I hope this was helpful. Bye, everybody. Take care.